healthcare law. Word today, the administration is spending $67 million for so-called navigators. Now, these navigators are supposed to sign up folks for these healthcare exchanges. So they're like goodwill officers? I don't know. But good luck getting young people to sign up, because a new study finds millions of them want to opt out. To pediatric urologist Dr. Hal Scherz, who knows why. Doctor, why? What's going on here?
Well, Neil, look who's signing people up. We have community organizers. We have Planned Parenthood, who are part of this Navigator program, who will be getting tens of millions of dollars from the federal government. And with 20 to 30 hours of training, you become a certified navigator. So that means that you'll sit down with these 20 to 30 hours of training. You become a certified ObamaCare navigator. And that means that somebody's going to feel content sitting down with one of these people and discussing their financial situation with these people. Give me a break.
But, Doctor, what do they know? What are these guys? Here's what worries me, and you're more tuned to this, so I want to pick your brain. Now, these navigators, in order to woo me or sell me on joining this, they're going to have to know something about me, right? So someone is giving information on my health or the lack of it, and saying, well, you know, Neil, this should be in your interest here. So that's what worries me. These navigators who sign up like you go through a Dale Carnegie course are all of a sudden, you know, getting information I don't think they should have.
Right. Well, I agree with you, and they say that there's going to be oversight on these people, so that
but
if there's any...
Is this the same oversight we had with the NSA? Because that one was
IRS and NSA, absolutely. They're, you know, I really, you know, am very confident about this. But Neil, you know, I think that what we're really looking at here is, again, we're finding out, like Nancy Pelosi said, what's in this bill. And every single day we're finding out new surprises about health care. And whether it's the edict from President Obama allowing people in Congress to have a different health care plan than you or I do.
That says it all, Doc. I'll tell you, that says it all. When the cooks in the kitchen aren't eating the slop they're swilling in the kitchen, that should tell you all you got to know. Congress wants exempted. Unions want out. 97% of federal workers who love their own system, and God bless them, who can blame them, they don't want to be part of this. That's all you need to know.
Oh, absolutely. And everybody who had a hand in putting this on all the American people are running away with it. Like Max Baucus said, it's going to be a disaster. But, you know, even people who are in the middle of healthcare, like myself, you know, who have an understanding of what's going on, we're not immune from what's coming down the road. My wife is a surgeon like I am, and we're both going to be forced to take our own health care plans from our own practices, even if one of us has a better plan. So that means that if you have a couple, both working, both who have health care insurance, one person in that couple may have better benefits. The spouse can't take those benefits. They're going to have to take the worst benefits that their employer is offering in this new reality. So there's so many surprises that are in store for us that nobody even really knows about yet.
Yeah, and that's why we bring to light
it's unbelievable.
Well, that's why we bring to light some of these fees, these things that, you know, the navigators and all that. You know, the president says, well, you know, much ado about nothing this way. We bring this to folks' attention just to say, did you know? Did you know about this? Did you know Congress wants out? Did you know 97% of federal workers want out? We just want to bring that to people's attention. That's it.
And if people think that the people who are in Congress being exempt from Obamacare is where this ends, where there's a difference in who gets what insurance, that's just the beginning. It's going to be the same thing with who gets what kind of health care, not just insurance.
It's going to get ugly. It's going to get ugly. Doctor, thank you so much.
It will be.
Very nice having you.
Thank you, Neil.